trying times to bear all this pain and difficulty that they're going through. Friends, we also would like to inform you that we have had a total of 118 tests that have the results of which have come out. 68 came out late last night, and 50 came out in the afternoon, late afternoon today. So out of these 118 cases, in the initial 68 cases, 6 had tested positive, and another 6 had to be retested, but the rest of those 68 cases were negative. And most of the people who tested positive were mostly the immediate family and house members of the patient. Apart from that, we received 50 results today from GMC, and out of these 50 results, all have tested negative. And we are waiting for another 43 from Barpeta Medical College. The results of that we should be receiving soon, but I don't have that with me right now. Apart from that, friends, I would also like to mention that different arrangements have been made to ensure that different people who were working in Bethany or were primary contacts have been isolated, and we're in a continuous process to contact, trace as many of them as possible, and the more the primary contacts which are there, we're trying to ensure that they are isolated and quarantined, and the testing is done at the earliest. In this, we'd like to inform you that from the government of Meghalaya side, we have made a lot of arrangements in all these locations. There are a number of Corona care centers. We have more than almost 600 isolation units that are ready, and all of them will be used for this purpose. I would also like to inform that arrangements have also been made to ensure that food and other facilities are provided to these people who are in the isolation wards. I received some complaints today that food was not reaching on time. Friends, I would like to clarify out here that the food has been reaching to the Corona care centers on time. But we have been having some challenges because the volunteers who were trained to distribute this in a proper and protocol manner within the Corona care centers were not able to reach the centers because of certain restrictions in certain localities, and maybe some families restriction and some other challenges that they faced. I would like to urge the society in general and our headmans and Rangbashnongs and elders that if they could be supportive at this time and allow these volunteers and other health officials and government officials to kindly come to duty so that our services are not affected. I can assure you that all the strictest protocols are being maintained, and these are protocols that are set by Government of India. So therefore, all these measures will be taken so that